Well, we have a room full of the hardy souls who found a boat or other means of getting themselves here today. Thank you for braving the floodwaters to be here. Welcome, everyone. I'm Sarah Rosen-Wortel, and I have the great honor and privilege of being the president of the Urban Institute and to get to welcome you all here today for a conversation with local leaders who are using evidence-based strategies in communities around the country to improve outcomes for children and youth. I want to make a special welcome to the three philanthropic foundations who are among the leading supporters of evidence-based policy and practice. So we have Eileen Berman of the Annie Casey Foundation, John Scianna Monaco. I did it well during the practice. And then Scianna Monaco? Jana Monaco. All right. Of the Laura and John Arnold Foundation, and Vivian Tsang of the W.T. Grant Foundation. So I want to thank all of you for being with us today, and also say a special thanks to the Forum for Youth Investment, who is collaborating with Urban on putting together this event. They bring their extensive knowledge and deep experience in evaluation and evidence about what works to improve youth outcomes and opportunities. So thank you, Karen Pittman, President of the Forum, for joining us today, who is looking. There you are. Hi, Karen. Thank you. I also want to welcome our virtual audience watching over the webcast, both live and later on the archive. If you are tuning in live, we want to encourage you to be part of the conversation. So you can submit comments to the email address events@urban.org at any time during the program, and we will feed those up to the moderators of each of the panels. And I also encourage all of you who are here today to continue the dialogue on the event. Let's avoid reading our emails. It's tempting, I know. But you can use it to join the online conversation, sharing your thoughts or observations using the social media handle Live at Urban. We put if each of you picked up the agenda for the event as you came in, you'll notice that the speakers' Twitter handles are on that. Please use that, and that helps join it to the conversation to their audiences as well. So here at the Urban Institute, we believe that data, facts, and evidence matter. Sometimes, every once in a while, it seems counterfactual, that point, but actually today's conversation is a proof positive that, in fact, they matter very much to the outcomes for young people's lives here in the country. We strive to help all levels of government and all service delivery programs build capacity to both generate evidence and apply it in decision making. It's easier sometimes for researchers to write their analysis just for their other fellow research academic audiences, and it's easier sometimes for program leads to go with what seems to be working, not taking the time to participate and work with data collection that's required with rigorous research partners, and to take advice from others who seem to not be sort of working with them in the salt mines, if you will. But both sides know that using evidence from high-quality research actually can help people to target resources as efficiently as possible, to improve performance and outcomes for the clients and the communities they serve, and to identify the best ways to structure their access to data, information privacy, and program operations and service delivery. And the groups that we're here to talk to today are doing that in spades. So we're going to talk about how you put evidence into practice, particularly in local settings, particularly on programs that relate to children and youth. We want to encourage others to follow along on the same journey and support local leaders as they improve their systems and test new practices with evidence that is timely, actionable, and relevant. It's also important to note that provisions of the 2018 Bipartisan Budget Act and even the administration's most latest budget proposals continue to create new evidence requirements and funding opportunities for evidence-based programs across a range of programs that support children. So it's more important than ever for local leaders who are working in service delivery in these areas. They look to others who are leading the way in the use of evidence and gain benefit of their experience. It's also important for all local leaders, certainly, to gain the perspective of the important funders who are leading the way in supporting evidence-based practice. So my final job here today is to introduce the two moderators who are going to moderate the two different parts of this program. First, we have a panel that will be led by Thaddeus Ferber from the Forum for Youth Investment. And our second panel will be led by Lauren Eister, who's a Senior Research Associate in Urban's Income and Benefits Policy Center. I'm going to leave it to each of our moderators to introduce the rest of the panel, but I think this is a crew. You all have the bios, needs no introduction. So let me just say finally, thank you to you all for being here. Thank you to you all for being here and on our online audience, and I look forward to seeing what we learned from today. Thanks.
Thank you, Sarah, and we are delighted to host this event with you today. It's a real treat to get to work with the whole dream team here at the Urban Institute. So Demetra, Jordan, Ivy, and everyone else, thanks for your partnership in putting this event together. For those who don't know, the Forum for Youth Investment works to change the odds that all young people can be ready for college, work, and life. And one of the primary strategies we use towards that goal is to connect research, policy, and practice. Another of the major focuses we do is connecting federal, state, and local policymaking. And so this event today touches on both of those themes, which is why we're particularly excited for the conversation today. We're going to kick off the panel with another set of rock stars in the evidence-based policymaking movement and three foundations. And you'll hear from the foundations, and you'll get to know, it'll be quite evident from their remarks that not only do these three individuals have a great perspective in the philanthropic community to observe across lines how evidence is not just created but is used, but they're also thought leaders in their own remarks. And so you'll be hearing both their foundation perspective but also what they've been learning throughout their careers. All right, so we have with us today Vivian Seng, the Senior Vice President for Programs at the W.T. Grant Foundation. For those who don't know, the Grant Foundation invests in high-quality research focused on reducing inequality and improving the use of evidence in discussions that affect young people in the United States. Next, we have John Shanamonico, the Policy Lab Manager for the Laura and Arnold Foundation's Results-Driven Government Team. Welcome. And then Eileen Berman, Senior Associate at the Annie E. Casey Foundation, where she oversees a portfolio of grantees creating and using evidence. All right, let's dive on in, shall we? So Vivian, John, Eileen, all three of your foundations in one way or another have been committed not just to improving the quantity and the quality of evidence that's created, but also in actually getting that used. And I think we're all learning that getting it used is probably harder than creating the evidence in the first place. So I'm very excited to hear. So what have you learned about what it takes to get people to use evidence, especially at the local level? And I think we'll go down the order we're sitting in right now. So Vivian, if you kick us off.
Sure. So one of the things that we learn over and over again when we've studied the use of research evidence, so not just going off of our assumptions, but really try to find out what does it actually take for research to be used. The theme that comes up over and over again is trusting relationships. And this is really important because in the evidence movement, we tend to think about the technical things that need to fall into place, right? The technical quality, the rigor of the research, for example, the rigor of the research design. And this is not to suggest that those things don't matter, but what it does suggest is that out in the real world, what influences policy, what influences practice decisions are these trusting relationships between people and between organizations. So if you think about agency leaders and agency managers, who do they look to for information? And information, including research, but information beyond research. They often look to their peers who they think of are trying to tackle the same kinds of problems. They're working under similar kinds of conditions. So they're looking to their peers. They're looking through these trusted relationships. They also look a lot to trusted intermediary organizations. So folks whose job it is to provide support in their work. So these could be technical assistance providers, it could be consultants, it could be the professional associations that they belong to. And these organizations, there's a lot of different kinds of them, and they vary quite a bit in the extent to which they focus on research evidence. But many of the best intermediaries are the ones who are keeping tabs on what are the key policy and practice dilemmas, what's the available research out there that can be useful to decision makers. They're packaging it, they're working with folks on interpreting it and making good use of it at the local level. So I would say we have to remember the social side of evidence use, not just the technical side of evidence use.
Thank you. John?
Sure. So I would echo everything that Vivian just said in terms of relationship building. And I think you have to, or at least when I think about it, you want to, as a researcher who wants to do evidence-based policymaking, engage your government partners in all phases of the research, not just on the end, not just on the translation. I think it would be, akin to going to dinner at a restaurant and a waiter showing up who you don't know and then bringing a meal to you that you didn't ask for, or that you didn't want, and then them giving it to you and you thinking this is not what I would like. So I think there are three phases to this type of work. On the front end, and this is probably the most important part to where you build relationships, it's getting to know them on a really deep personal level, trying to figure out what kind of questions that they want to be asked, and then double checking and triple checking that the questions that they want to be asked are the ones that you're going to propose in a research study. Often, building relationships with governments, from what I hear from the partners that we have, can be really as simple as going out to coffee with them, or grabbing lunch, or having dinner parties. Very similar to speed dating is the analogy that I've heard. Getting to know them on a personal level so that you can begin to build those trusting relationships and that bond is something that's so important. And then also in the front end, when you're setting that agenda, making sure that the questions are really being driven by government and not being driven by you, by your own research interests. I think that what we found is that when government drives the agenda, the probability that the research is actually used on the back end is going to be much higher. The second phase that I think of is this middle intermediate phase, where you keep government engaged throughout the entire process. And this can look like many things. One, it can look like having your research team actually pairing up or working really closely with program officers, people who work in government, getting to step into their world and informing yourself of how their programs are run, so that when you go back to the research, you have a really well-informed perspective on how the programs are run, and you're not just doing it based off how you think the programs are run or what you would like the programs to actually be run. Good communication plans are also a really good way to facilitate this, and I can give an example. So as Thad said, we work in the policy lab space at the Arnold Foundation, and we have one here actually in DC. It's called the Lab at DC. It's based in the mayor's office. And something brilliant that I think they did when they did a really potentially controversial topic around body-worn cameras. They did an RCT on it. But they rolled out such a brilliant communication plan that I think it made the results really palatable to everyone, including those in government and in the community. They sat down with government and they said, here's our pre-analysis plan. Here are the questions that we're going to ask, and here are the outcomes we're going to measure. So that at the end of the day, when the research is done, you know exactly what we've been working on, you know exactly what we're trying to study. They had frequent updates with them where they were able to provide them with information. So there were never any surprises. And that information was then bubbled up to the top of the MPD, where they had where MPD leadership had frequent updates with the police chief, for example, and was able to keep him in the loop. And then another thing they did, which I thought was great, was they held community forums where they invited the public, people who don't really have a background in research or methodology, but was able to explain to people, to lay people, what the project they were doing, again, what kind of approach they were taking to solving, to looking at body-worn cameras, explaining why randomization was important. I think the mayor went on Morning Joe one morning, and someone asked her, why is it taking so long to roll out these cameras? Why don't all the police officers have them? And her response was, well, we need to randomize. We need to have a control group and we need to have a treatment group. And it was fantastic to hear someone like the mayor of DC be able to explain on national television what a control group was and why it was important. And then I think the last piece of that middle phase is having really good crisis communication plans or communication strategies to be able to roll out once results come, or to have communications plans to respond in case of emergencies or something gets out to the public. So everything was just in lockstep order, and government felt like they were constantly updated, kept engaged, felt like they were almost owning the project themselves as much as the research team was. And then lastly, and probably an equally important part is that translation phase. And of course, writing good policy briefs and having nice websites and being able to, to have materials that are easy to read are important. I think we may sometimes even underestimate how important that is. I know I'm here, someone who's read a bunch of policy briefs, and I've come across some that in less than 10 seconds I've decided to move on, and I've had, this is something I had to do for school when I had plenty of time. So writing good policy briefs is really important. But also having people, both research directors, but also executive directors who have really high political IQ and emotional IQ, who are persistent, who are patient, who are willing to go that extra mile to make sure that government understands what the research is. They are able to see opportunities and windows to present the research, to testify to the legislature. If you think not even the best policy research is not going to be used if you just say, here's my research and that's the end of it. You really have to go that extra mile to make sure that government understands it and they use it. And sometimes it's not going to happen immediately. Sometimes you have to wait for that right window. So this is all to say, I think at the end of the day, if you can keep government engaged, feel like they own the project, feel like that they have some skin in the game, once those results do come out, they're going to be so excited to see what they are, and they're going to be the probability that they're going to use them, I think, is going to be higher.
Well, thank you. I loved the waiter analogy. I'll be borrowing that one in conversation.
Oh, yeah.
Yeah, Eileen.
Well, I think so many important points have already been shared, and I just want to underscore the importance of relationships. I think I would say relationships are really key here, and the trust that needs to come along with those partnerships that can be built through being transparent, taking time. I think one of the things that we often have to pace ourselves with is that to do this work, and to truly involve all of the relevant stakeholders, that takes time, even if we think we know the answer. And also figuring out where there are shared agendas and where there are divergent agendas. So I think, as John said, what are the questions everyone wants answered? What are the shared questions that people want answered? How can evidence be built to solve challenges that various partners have? And what aren't we going to do in a particular project, and being clear about that from the get-go. I looked back, we supported a brief that asked some school districts that are doing social emotional evidence-based programs and some child welfare agencies that are implementing evidence-based programs. And these districts and these agencies have been sustaining and funding these programs over a long time. And so we wanted to know, what is it that others who are looking to do the same can learn from their experience? And a few things, there are a number of strategies in these reports, but I'll pull out a few that I think are really interesting. One is to think, and we wrote this brief through the lens of implementation, understanding that the exploration and installation, as well as the putting a program into place, continuous improvement, thinking about funding sustainability, all require different strategies. So the building of the partnerships, the thinking about what data are we going to collect, how is that going to be collected, who's going to do this? I mean, some of the technicalities can be really important in order to achieve the long-term goals. So thinking about what is the path, and that path is not going to be a linear one, is just essential to putting evidence into place and for it to stick.
Yeah, so I wanted to add something, because I think all of these are really great points. And I would say if we take it even further, the trust and the trusting relationships in a way can help create some fertile conditions for the use of evidence. But what you also need on the agency side is a culture, capacity, and routines that foster the actual use of that evidence. So I think many of us have been working for a very long time on trying to support research that's actually more useful, right? It's more accessible. But just because something is accessible and useful doesn't always mean it gets taken up and incorporated into decision making. So we really need to think about the organizational conditions that foster that. And so some of the lessons that seem to be emerging is, there's of course skill sets, right? This capacity skills of folks to get their hands on research to make sense of it. But there are also these deliberative spaces where people can come together to make sense of the research evidence and think about it in the context of very particular decisions that they're trying to make. So for example, in a school district, as they think about curricular changes, as they think about redesigning algebra pathways, as they think about their professional development programs, in the context of very specific work that they're trying to do, that there are opportunities to deliberate on the research evidence and all the other things they're thinking about and really incorporate it into their work. I would encourage us to think about building organizational routines that foster the use of research evidence so that it's not a special occasion, it's not something that happens Tuesdays at 9 a.m., that it's something that's built into the organizational culture and routine. Of course, it takes the leadership of an organization, an agency, to really say that this is important and to make sure the resources and the time is set aside for all of this to happen. And very often, it can be within an agency having a strong set, maybe a research department or a research office, as well as it can also be useful to have some of these external research partners, which I think John and I and Eileen have also been referring to.
Yeah, so let's stay on that. Integrated all three in one way or another: relationships, which is the same thing that we have learned from child and adolescent development. The 3 R's are relationships. So let's stay on the relationships piece. And I think why the forum focuses on crossing lines, research practice policies, is that the field as a whole divides up work into silos. And if there weren't these silos, we wouldn't be here having these panel conversations about how you connect them. And so I want to think about and get your thoughts about structural considerations. So you've mentioned the labs, we've mentioned intermediaries and research practice partnerships, which I hear as the conversation of maybe there's structures that will make it more likely that it will allow the relationships, the culture, the routines that you were talking about to manifest. So I'd like to pick your brains on that a little bit more. So Vivian, let's start with you and the research and work you've done around research practice partnerships. What are those and what have you learned about what works?
So we, for about 10 years now, have been supporting research on the use of research evidence. So really actually trying to study what are the conditions under which research is more likely to be used. And one of the things that has emerged from just us trying to understand that is the value of research practice partnerships. They have emerged as one of the most promising set of strategies that we have seen to date. And the way we define partnerships, so the word partnership has a lot of colloquial meaning and a lot of people use that word, but when we think about research practice partnerships, we're thinking about long-term collaborations between researchers and practitioners focused on problems of practice that are co-defined. And so there's a lot of parts to that. One is that it's a long-term agenda. And so much research is project by project. It's what some people might call drive-by research. You do a project here, and then you do a little project there, and there isn't the sustained relationship. And so we think the sustained relationship where researchers and practitioners are working together on hard problems over the long term allows them to dig more deeply into the problems as practitioners try things out, to continue to learn from them, to iterate and try to do better. It also builds the trust that we've talked about so much about, and that helps foster more productive relationships, more useful research evidence, and also promotes the trust that can foster the actual use of the research evidence. And then, you know, we also think about these partnerships as really emphasizing mutualism. So the partnership is not driven solely by the interests of the researchers, which a lot of time, you know, those of us from academic settings or even some like research institutes know this, right? It's like you have some grant money and you go in search of a site to do your research. Or maybe it's driven by the practitioner side. They have a piece of work they need to do and they contract out for it. And that's what creates the sort of scattershot research projects that we have, rather than a coordinated, aligned body of evidence that really helps to solve problems. And so partly what we're thinking about is a research agenda that's quite focused, aligned, there's mutualism, it fits the interests both of the practitioners, real problems they're trying to solve, as well as the researchers and their areas of interest and the things, their expertise that can be brought to the table. So we have found that research practice partnerships, and they take a lot of different forms. Coburn, Penewell, and Guile have written an excellent paper on research practice partnerships, a landscape scan, and they talk about 3 different kinds of partnerships. A research alliance, modeled at the Chicago Consortium of School Research, which many of you may have heard of. Design-based research partnerships, where researchers and practitioners are co-designing solutions together and co-testing them together. It's often focused on curricular issues or professional development, things very close to the classroom. And the third type being networked improvement communities, pioneered in education very much from the Carnegie Foundation for the Advancement of Teaching, but also drawing from healthcare and the Institute for Healthcare Improvement, where there are larger networks of practitioners that draw on research to do these plan, do, study, act cycles to drive continuous improvement in practice. So there are a lot of different ways that these partnerships can take shape, but they're all united around this idea of a long-term agenda that brings researchers and practitioners together in trusting and mutualistic relationships.
That's great. And if people want to learn more about research practice partnerships, trying to remember the URL, rpp.wtgrantfoundation.org has a lot more information about that. All right, research practice partnerships. John, you talked about policy labs in your opening remarks, gave some examples of what them take, but could you back up a higher level to what is a policy lab, and do you see this as a structure that has merit that might be replicated?
Yeah, sure. So definition of a policy lab is the infrastructure that allows researchers both in government, outside of government, to be able to access administrative data and to use that in order to produce action-oriented, timely, high-quality, rigorous evidence for policymakers. And we think about policy labs at the foundation as supporting 3 key elements, or having 3 key pillars to them. The first is good research. So research that is both rigorous, but also policy relevant and timely. Research that is both nonpartisan and objective, but unafraid of answering big, thorny questions and going that extra step of making recommendations. Research that is answering really big questions and really exciting questions like how do we predict homelessness, or how do we come up with a new intervention to eliminate infant mortality in the state, to some really basic questions that states need help on. For example, how many programs am I offering to reduce recidivism? I mean, one of the labs is working on that question right now because the state actually doesn't know. And then these questions are exciting, one, because they produce really actual tangible information, but to Vivian's point about having a coordinated research agenda, you can then take that information, then you can say, okay, here are my programs. Let's maybe run an evaluation, a quasi-evaluation on this one, this one, and this one, and see if they're working. And then from there, once you have that information, if you find that maybe some of these programs aren't working, you can take an idea to run a new program, to do a new RCT, or to pilot a new intervention. And so it's a research agenda that kind of builds up, but it starts with a very, very basic question. So that's the research bit, just trying to change how research is done in these academic settings. The second is being pioneers and champions of integrated data systems. And for those of you who may not know, integrated data systems are basically what they sound, taking data that is siloed, most often siloed in agencies, in health agencies, in education agencies, in criminal justice agencies, workforce agencies, and being able to link them together. And the purpose of that is so that you can really form a 360-degree perspective on the population that you're trying to help, rather than just knowing a slice of an individual, that is his or her workforce experience, or that is his or her education experience. And what we've learned is that when you have the whole picture of a person, you can learn a lot more about how these programs interact with each other, whether certain programs are more effective than others, whether certain programs are enhanced by the addition of another program, or are actually being made worse off by the addition of another program. So there's a lot more experimentation, a lot more learning that can be done, as opposed to just saying, well, I know this person's K through 12 history, and there's not much more that I have on that. And so we want these policy labs to proselytize the idea of integrated data systems. And in some states like Rhode Island or in Colorado, even here in DC, to be the builders of them, and to work with the state chief data officers, or to work with their IT officers to help them be able to link this data across agencies, while also, of course, ensuring things like privacy, observing federal and state data laws and as such. And then the last pillar, I would say, is this government integration. It kind of goes back to what we were talking about before, about getting to know the people who work inside government. We want these labs to be fully embedded in budgeting processes. We want them to be embedded in procurement processes. We want them to be best friends with folks in the legislature or in agency heads. Because when you have that open chain of communication and that open dialogue, we think that the probability of evidence turning into action is just going to be a lot higher. And I think this is important because for those of you who've worked in government, you probably know that a lot of the work that you do is putting out crises or managing big teams or having to deal with issues of compliance, and that you don't have a lot of time to come up to the service and to breathe and to ask yourself, okay, how do I solve this big problem that I'm facing, or where can I get some really good information? And what we want is, when these people do surface, we want the first thing them to see, or the first thing that they think of, is the policy lab, and that they just have, all they need to do is make a quick phone call, in some cases actually a text message in some states, but really to have that go-to place that they know that they can get really good, trustworthy information. And on this last point, Thaddeus, about how do they sustain it, I mean, I think you've heard it from all three of us about relationships, and it can't be emphasized enough. And I would say that when you have trusted relationships, government partners are much more likely to give you maybe more politically sensitive projects, projects that could unearth really interesting findings, or they're more likely to share with you personal identifiable information, administrative data that could be used to leverage into big projects. And so the government integration relies, if you don't have the relationships, you don't have that integration piece.
That's great. And the telephone piece is poignant. As one of the research practice partnership sites famously said, as a policymaker said, well, I have a researcher on speed dial, right?
Yeah.
All right, I'm going to pivot to you in a second, Eileen. I do want to let folks know, if you're watching at home, you can submit questions to events@urban.org. So I'm going to pivot us to a new question, which is that all three of your foundations, in one way or another, are working to close some of the profound equity gaps and disparities in this country. And at the same time, as the saying goes, knowledge is power. So I'm always very interested in the overlay of those two concepts of how do you make sure that you're not just using evidence to close equity gaps, but also using an equity lens to the processes through which you create and use evidence. I'd love to hear your thoughts on that, Eileen.
Sure. Well, I'll point to a very specific framework that we've created to help improve child and youth outcomes. So recognizing that there are these inequities and that there is evidence that tells us how young people can do better, we've created the Evidence to Success framework. And it is a collection of strategies and tools and approaches to help communities do a lot of the things that we're talking about here. How do we get community members, public agencies, and policymakers working together to improve those well-being outcomes. And I'm delighted that Matt Billings from Providence, one of the Evidence to Success sites, is here, and so he'll be able to dig deeper into what this looks like in a real community and what some of the specific steps have been to address some of the inequities that they have uncovered in their work in Providence. But just to highlight some of the tools that have been created. One is a way to get youth voice into the room. So the Evidence to Success work is led by all of those partners that I mentioned, and they work from the get-go to form partnerships, define roles, and with the goal of saying, what are our community priorities? What are the most urgent needs for our children and youth in our community, and how are we going to address those with existing evidence-based programs? We've designed a youth experiences survey that provides population-level data on young people in middle and high school, and also there's a survey for parents of young children. And when all of those partners are at the table saying, what do we want to prioritize? Where do we want to put some prevention into place in our schools or in our communities or with support from public agencies? That youth voice from the survey is at the table. So we hear from young people if they're having opportunities that are positive in school, if they have a strong relationship with an adult in their lives. And using that as a way to then get community members and some of the key agency folks together to say, what are our needs and how are we going to address them? And I think some of the equity question here is that everybody at that table has been involved all along. So understanding how this survey works and how it could be used, everyone then comes to that table with that knowledge as well as their own experience, as well as other data to help corroborate what the real picture is here. And so everybody has a voice in setting priorities and determining the fit and feasibility of evidence-based programs and looking at how are resources currently being spent and if there needs to be a shift in investments to more effective approaches.
That's great. So going back to the waiter metaphor, it's not just asking policymakers what they want to order off the menu, but asking some of the disenfranchised communities what questions they would like to see covered in evidence. That's great. And Vivian, so you've talked about democratizing evidence or democratizing data, right?
Yeah.
What is that and what does it look like?
Yeah. So I'm going to actually try that analogy, that restaurant analogy. It's kind of like at a Chinese banquet, maybe, when you've gotten 9 of your best friends together and there's 10 of you and you have to order 10 dishes and figuring out what are those 10 dishes going to be and in what order are you going to have them brought to you. It is not efficient. I mean, if I wanted to decide what those 10 dishes would be, it would be much faster and it may even be better. But the group may not enjoy it as much, right? It may not be as satisfying or as fulfilling to the group. So I just want to play off of that. We're all riffing off of this. So some colleagues and I have been thinking and talking a lot about this idea of democratizing evidence. And in particular, we've been thinking about it in education, but I think it has relevance for a much broader set of areas. And if I could back up and tell you a little bit about how we got there to thinking about this. As I mentioned, our foundation has been thinking a lot about the use of research evidence. When does it happen? How does it happen? How do we make it happen more often and more productively? And I was thinking a lot about the use of evidence in education. You know, over the last 15 years, I would say that if you look at teachers, and their sort of perspectives and attitudes towards evidence, it has not always been very positive. I mean, you have teachers who say, You can get research to say just about anything. Policymakers are now saying everything that's going wrong is because of teachers, and they have research to show for it. And they don't trust, there was a lot of distrust against data during the NCLB era too, because they suspected the political motives that were behind this larger policy agenda. And then if you think about an even longer history, way past the last 15 years, there's also been a history of schools in general not trusting research very much. And the sense that research was often done on schools, and this sort of drive-by research, but not with schools. And researchers would come in and out and not leave anything particularly valuable behind for the schools, even though the schools had participated and put a lot of time and energy and staffing into this work. And so you think about this context in which evidence is so distrusted, and the people conducting the evidence are not very well trusted, and the federal policymakers who are trying to create more evidence use are not particularly trusted for their motives. And so this really, as a research funder, this got me really thinking, me and my colleagues, about, well, what does this mean, and how do we try to undo some of this? And what we started to think about is really going back to some of basic democratic principles. And I think those democratic principles are really reflected in the work that Eileen was just describing, which is that if you think about teacher policy for the last 15 years, it did put a heavy emphasis on the use of data, but it did not have much of a teacher voice in defining teacher policy or in defining how data should be used. And so if we start to think about the evidence movement as incorporating democratic principles or being based more on democratic principles, then we might think about the variety of stakeholders who should be at the table on the front end in defining research agendas. And so this is very much what John was talking about earlier. We could talk about the different stakeholders who need to be at the table in making sense of the research evidence, interpreting what does it mean for our local context, for the conditions that we're working in, for the students or the young people that we're serving. And what does it mean? What does it imply for our reform agenda? What does it imply for what we should be doing next and what we should be trying next? Now, like that Chinese banquet analogy, that process of deliberation is not efficient. If any one person went in there and decided what the agenda was, decided how the research should be interpreted, and decided what it meant for policy, that would probably go by very quickly. But it also creates a lot of discontent. So I offer up these democratic principles not to suggest they're a panacea, because democratic processes are often not more efficient. They require compromise and negotiation and coming together. But if we engage in this process, what we might see is that data and research evidence can also help people come together and understand maybe what are the common problems we want to work on, what is the scope of the problem that we want to work on together, and help also bring people together and align our common understanding of what we might do about it together. So instead of using data and evidence, I think, to create more fissures and to reinforce some power dynamics, we could actually use research evidence and data to bring folks together to try to solve some of the most important problems that we have facing our country.
Excellent, thank you. Last question before we open it up to the folks in the room. And again, you can email events@urban.org online to submit your questions. So in the federal landscape of evidence-based policy making, one of the most visible strategies has been you take a national branded program that exists in sites across the country, do an RCT, show that it's effective, and then it goes into a federal clearinghouse or a non-federal clearinghouse of programs that work, which is great if you're in a community at the moment of, I'm selecting a new program to bring into my community. That's a great place to start. But that does very little for all the existing homegrown programs that you're going to find in any community. You go into a community, you'll find maybe a spattering of programs that are part of a national initiative. But by and large, most programs are not. What have you learned, or what does it take to, what's the message to them of how should a local program be thinking about using evidence? I'll start with you, Eileen, on this one. Yeah.
So that's a perfect segue for me to put a plug in for a new video series, which is called Becoming an Evidence-Based Program. Child Trends produced it based on doing this work for years with local nonprofits, helping organizations think about how can we use data and program management to improve our program, and do we want to go down the evidence building path, and if we do, what's that going to take, and what are some of the considerations that we should keep in mind as we think about, do we want to evaluate our program, and are we ready for an RCT? So it's meant to be a very accessible, sit down with your colleagues, listen to the story of an organization that has been going through this process video. Another thing that we have been doing is we have a portfolio called Expanding Evidence, which is geared specifically to helping developers of color build programs for communities of color. And many of these are teachers or practitioners who have seen a need, have ideas about effective solutions, put them into place, and are interested in doing some of that evidence building for their program. And I would say one of the really important considerations is having community help define what do we mean by success outcomes. So, what a researcher may see as a success outcome may not necessarily be what the community wants. And so paying attention to culture, paying attention to community needs and priorities is just essential, I think, in doing this work.
Excellent, thank you. I want to get to audience questions in a sec, but briefly, why don't you pick up on that same theme, John? What are you seeing about what are the first steps someone needs to take to build their internal capacity to collect and use evidence?
Yeah, that's a great question, Thaddeus. So I think I think some ideas can apply to if you're running a government program at a major scale, or if you're in a school doing perhaps like an after-school program. I think some of these suggestions can apply. The first is to know your data, know how it's being collected, know who it's being collected on, know how it's being recorded, and making sure that when you have data in those big Excel files, making sure that you have code books for people to easily understand what the data is representing. I can't tell you how many times I've opened up an Excel file and I've had to try to decipher what a really confusing looking variable is at the top of a heading of a column, and spend more time doing that than the actual analysis. So have really clear processes for understanding data, and really make sure that you know what your data is representing and how it's being collected. The second thing along with the data is getting baseline information on the population that you're trying to serve. This can be demographic information. It can be where do they live in your community. It can be, if we're talking about a school, are they on free or reduced lunch status? Can you get academic outcomes on them? Can you know what other programs that they're serving? Again, trying just to paint an entire picture of the population that you're trying to solve will just be really informative to the person or the team who's going to end up helping you with any research questions that you have. And it also provides a really good foundation for running an RCT when you have that information already provided. Before you do run any evaluations, or you have people come in and run evaluations, I go back to something I said before, which is to make sure that your researchers really understand the ins and out of the program. Get them away from their computer for a day or two or a week or even a month if you can, and have them sit in, watch how the program's being run, watch how it's being executed. I think the medical community has a great advantage in that some medical researchers are not only really trained and have the deep content expertise, but they've actually observed medical operations, or they performed medical operations themselves, and so they have that understanding of how these programs and how these how these operations are being run, so that when they do their research and they're thinking about new interventions to pilot, they have a sense of whether or not it's going to be feasible, and how a doctor or whoever the end user would actually be able to use it. And then the last point I would say is make sure that your frontline workers, or the people who are in charge of administering the programs, are properly trained. And it's important because you can have a really excellent research question, and you can think that the research, the process is going well. You can spend 3 years and X million dollars of money on it, And at the end of the day, you find null results, or maybe you find results that look really promising and are significant, but then you learn that the implementation was flawed, or there wasn't consistent implementation across the board. And that is going to just throw your entire results out the window. And so I like to say, and we've probably heard it before, is that good policy is nothing without good implementation. And so if you want to understand the effect of a policy, before you come in, before you start to build that capacity to look at it and to examine it and to put it under a microscope, make sure that it's being implemented well. And that can start with trainings or educations or observations, whatever format you think is going to help make sure that things are going well.
Wonderful, thank you. Well, let me take the time to open it up to questions. There's people with microphones, so if you just raise your hand, we'll try and get to you. We've one in the front here. If you could just introduce yourself briefly and share your question.
Yeah, I'm Greg Squires from George Washington University. I'd like to ask what role any of you see for nonprofit advocacy organizations. And I say this knowing that these groups have an agenda, but the good ones understand that their agenda is not served by biased research. That, in fact, they understand that their research has to be probably cleaner than anybody else because they're going to be challenged. And I also say this with the understanding, given what you said about trust and relationships, governments are often reaching out to communities, and they're having focus groups and town halls and meetings. And there's often an understanding that this is just window dressing after the decisions have actually been made. We used to call this a mobilization of bias for those who remember older social science research. And I guess this gets at the trust thing. So that I see a lot of barriers that are blocking what could be an effective role of advocacy groups getting into this game. And I think of the Home Mortgage Disclosure Act, which is probably the best example of democratizing data that's had real policy influence. So how do you see advocacy groups encouraging others to use evidence-based policy decision-making?
Well, I don't think there's any getting around the role of advocates in policy decision-making at any level. Policy, and that's from the front end of policy through policy implementation, all of it. I mean, in our political system, advocates are a hugely important role. And in fact, when you ask legislators, in particular, at any level, what is their primary source of research evidence, it's advocates. I mean, advocates are the ones who are there with them and their staff, packaging research to make a stronger point. So research in our political system, undoubtedly, research evidence will always be used to support particular advocacy goals. But as you say, I think we shouldn't get too cynical about that. I mean, this is part of our political system. And there is a lot of variation in the ability of different advocacy groups to understand research evidence, that their networks and their contacts with researchers vary. Some of them are quite sophisticated, others are not. And I think it behooves researchers to build some stronger relationships with advocacy groups and understand, too, what is it that advocacy groups see is on the horizon. A good advocacy group is often probably among the best predictors of what are the policy issues on the horizon, what's possible and what's not. And that's very useful to come back to researchers, because we're terrible at anticipating what's going to happen, right? That's why research agendas are often too far behind. So just understanding that, what is going on, and what are the political dynamics? Not research can't answer all questions. Research is not going to help us, I think, deliberate across our value differences. That's not going to happen. And in a democracy, we're always going to have value differences, and we do need to talk about them and deliberate over them. But research evidence sometimes can help clarify, if you take this course of action, what's likely to happen? If you take that course of action, what's likely to happen? Now, our values are still going to come to play in those decisions, but research evidence, even on some of these politicized questions, can still be valuable and help bring some clarity to the issues. Won't resolve the issues, but could help bring some greater clarity to the issues.
So I'd love to get to more questions before, so if there's additional questions. All right, I feel were you chomping at the bit to get in on a question?
Yeah, I think it's a fantastic question. I, like Vivian, see advocacy and advocates and advocacy organizations playing a pretty important role here. because I think sometimes data and really good evidence, even really good policy relevant research, is just not enough. Is not enough by itself. It doesn't stand up on its own. And so you need color, you need stories, you need that emotional kind of component that you can package with the data and the research and then be able to sell it or to be able to present it to people in government. Because we know at the end of the day, that that's what drives decisions. It's not always the facts. To be frank, I would also say though, we have to be careful. Researchers have to definitely be careful about looking too cozy or working too closely with advocacy groups, because we want to make sure that research is always transparent and it's objective and that it's perceived that way as well. But I mean, two examples that come to mind of how advocacy has worked really well. One is in my hometown of Houston, where we have a small little policy lab, the Houston Education Research Consortium, that did some research on the pipeline to prison and looking at how harsh disciplinary policies can affect kids later down the road when they're in high school, lead to dropouts, lead to higher rates of incarceration. And that research was picked up by a local advocacy group, used with the Houston School Board to be able to be the first city in Texas to pass a law banning suspensions for minor offenses for kids in grades K up to, I think, second grade. That law was then passed in Dallas. I think it was passed in Austin, and then it bubbled up to the state level, and Governor Abbott signed a law banning it across the state. So I think that's a great example. I think a more recent example, actually, that just happened last month, if you're from Colorado, the legislature passed a law that allocated more funding to foster care youth to help them stay in their school of origin, even if they move from foster care placement to foster care placement, because the research that undergirded that policy found that when students who are in foster care often move high schools at least, on average 3 to 4 times during the first 4 years of high school. Sometimes, foster care students are in high school for more than that. And so the dropout rate or the graduation rate for foster care youth is only a third compared to about 75% for the rest of the state. And so there was an advocacy group that worked closely with the researchers in Colorado. We're able to pick up that research. We're able to go to state legislatures, again, kind of go that extra mile if the researchers can't always do it, talk to the legislature, wait for that right political window. And then I think, just 2 months ago or a month ago, the law was signed by Governor Hickenlooper. And so if researchers themselves can't be the ones who take the research and really push for it, because there are fears for being too, looking like a lobbyist or not being perceived as being totally independent, I think that gap can be filled by advocacy groups for sure.
Thank you.
Thank you for the question.
I'll just mention one other point, which is, we're a foundation that's focused on helping children and youth, and I've been so impressed with the youth advocates. And I think there's opportunities that philanthropy has to help support youth getting the skills to be savvy with this data and telling their stories and helping to make changes, because they're experiencing these things and they can be some of the most powerful advocates in that space. Exactly.
Yep. Question in the back.
So thank you so much. Andrea Robles from the Corporation of National and Community Service in the Office of Research and Evaluation. And I just want to say all the issues that you're touching upon is something we think about all the time. I mean, how do we work with local communities to identify issues that are a priority to the communities? How do we build these trusting relationships? How do we work with different partners in order to not only build capacity, but be able to use that information? And so one of the things we have done this year is decided to do a grant competition with participatory research. And I just want to say that we thought this was going to be a small competition, and we've had hundreds of applications from universities and communities, so there's obviously a need to do what you're putting out. But this is very difficult to do as a federal agency, and it's also, to your point of having a research strategy, not just having a project, but a research strategy. So I guess I'm asking all of you, how do you start building those seeds? I mean, one thing is to say this is what we have to do, but then how do we actually, as federal agencies or foundations, work together to promote that?
It's a great question to end on, and I thought that example was great, right? That's what you have done is an example of how federal government can try different things that does allow evidence use to increase. Who wants to join in on that question?
Yeah. So as an overarching strategy, I think it's so important that we begin by listening and learning. And that is so counterintuitive, I think, both for federal agencies as well as foundations, because we like to set agendas for others. And often we can do it with a lot of hubris, right? That we presume we know what the questions are that need to be asked. We know what the agenda is. And we just got to get folks to implement it, or we just need to get them on board, or we just need to build the political will for that. And so I think in some very authentic ways, we need to figure out we need to listen and learn from what are the core problems of practice on the ground. I'm glad we're starting with this session with a focus on the local level, So at the local level, what are the key problems and issues? Really get inside them and understand them in a deep way. And then back out into what is the larger research agenda built on that. And then I think if we understand it locally, we can also start to see what are the themes and patterns that we're seeing in certain kinds of communities, in rural communities, for example. It's not that there are themes, sure. Local communities are different, but there are also some common themes. And then if we start to think broader at a national level, the federal government and national foundations, we're well positioned to then look at what are the common themes and what does it make sense strategically for us to focus some of our efforts. But I think it starts by making sure we're even identifying the right problems that need to be solved locally.
All right, we are at time, so if you could join me in thanking Vivian, John, and Eileen very much tonight.
Thank you.
And I just want to say thank you for staying for this part of the panel, because we get the chance to speak to folks working at the local level, both to bridge the gap between research and local practice and programs. And I'm excited especially to be moderating this panel because I'm one of those researchers that works on large federal evaluation projects. So I know what it feels like and get to see folks at the local level, get to interview them and really understand the value of being able to convey why the research is important that we're doing, giving local folks the opportunity to really share what they think is working well with their programs, as well as what the challenges are that can really help inform others trying to replicate what they're doing, really being able to understand what the numbers are saying and linking the outcomes to the implementation. So I think a lot of what we just heard in the last panel really resonated with me in thinking about those issues. And I know our panel today will really be able to share their experiences. To my left here, I have Ruth Nilde, and she is a researcher, a longtime researcher, actually getting a chance to really bridge those gaps in Philadelphia with the Philadelphia School District. I also have Matt Billings. He is with the Providence Children and Youth Cabinet, and it's an intermediary that really works to bridge evidence and bringing evidence to local programs that support children and youth. And then I have Lily Elkins with the ROCA program, and they do work at the local level with at-risk young men and young mothers. And they really, this group and this panel can really help us understand bridging that gap between research and practice and policy, and really help us think about how federal policy making can be informed by their activities and really being able to use evidence effectively to improve programs. So I'm going to start off asking Lily a question because I think, talking to Lily, she really has the at the local level perspective, working directly with youth and with at-risk young men and young women. And you're addressing such a challenging population, really trying to help them support their multiple needs, which is oftentimes hard to capture all of that and address all of that in evaluation. So I was just, but I think so much of your work has been in understanding what's going on behind the numbers, really bringing evidence and a culture of evaluation to your organization. I was wondering if you could start off by talking about how that works with ROCA.
Sure, I can try. So just to say, ROCA is an organization that works with really high-risk young men and really high-risk young mothers who won't go to other programs, which is kind of important to say because most of our big funders and our federal funders have said to us, you should use evidence-based practices, but as it turns out, there aren't any evidence-based practices for kids who don't go to programs. We've tried, they don't exist. And so our answer to that was to start researching our own work and to try to figure out what we're doing. And so we've had long-standing partnerships with researchers, most longstanding with APT, who does a lot of research, APT Associates, who does a lot of research around our young men's program, and more recently, oddly enough, with Urban, who does research around our young mothers program, and trying to understand what makes young people change their behaviors. And we have spent probably the last 16 years building a culture in the organization where every decision we make is made based on evidence. So probably the clearest example of that is about 6 years ago, after what I believe was our fourth theory of change process, we got rid of about half of our programming. And we decided, while some of it actually worked really well, it wasn't the place where we really moved the needle the most. And so the thing we figured out we did really well with and had the most effect with, and the thing nobody else was doing, was working with high-risk young men who won't show up. And we do that by stalking them, which is kind of irrelevant, except to say, if you come to ROCA and you say you want to be there, you're not a ROCA kid and we send you somewhere else. And so trying to figure out what it takes to make that happen. So for example, and we probably didn't need a researcher to tell us this, but at one point APT said to us, what makes kids change their behavior is two to three face-to-face contacts a week about behavior change. Intentional contacts about put the gun down, stop dealing drugs, whatever the issue is, face-to-face. One contact doesn't work, 10 contact doesn't work. I have worked with young people and teenagers my entire life. You can't tell any teenager something once, and you can't tell any teenager something 10 times, because in either event, they will shut you out. And we should have known that. But APT looking at the data and saying, no, this is what you need, 2 to 3 contacts, that helped us design a model that said, we're gonna do this. Same thing with how long a kid could be in the program. But the thing that probably matters more than any of that is that in addition to having a culture around data, we have someone internally who manages it and pays attention to it. He was a ROCA kid, as it turns out, and he grew up to be our Director of Evaluation and Learning. But it's his job to pay attention to that all day long, and what's unique about that for us is that he understands the model and what we're doing. Because the challenge we've had with researchers forever is that no one quite understands the model, at least not initially, and it takes a long time to get someone to do that. So having someone like our Director of Evaluation who can say, no, but that's not why we do that this way, and that's why this works this way, is, I think, the thing that's been most helpful.
That's great. So Matt, I want to turn to you and, discuss data and analysis, for your organization to inform the programs that you work with. And the way Demetra Nightingale put it is that you all seem like the epicenter in Providence on data around children and youth being able to inform programs. So what is the cabinet, and how have you expanded what you do and your understanding and use of data and evidence?
So it's kind of an origin story, right? I think to start, we were convened as a backbone for a collective impact network in the city of Providence. We were very focused on place. We were very focused on key sets of outcomes and indicators. And what we found out early on, as a very small staff, we were providing the functions that traditional backbones providing the collective impact world. But what we found out really quickly is that we weren't fitting into larger networks. We started to explore what evidence meant. It started to explore in 2012. We became the pilot site for the Annie Casey Foundation's Evidence to Success work. And it was at that point where we were struggling with our identity a little bit. And things like evidence and finance and other pieces broadly weren't part of the collective impact framework. And the idea that residents and community members play an active role in setting those priorities and in advancing that work wasn't quite there yet. And we definitely quickly found a home with the Forum and the Ready by 21 network, who started to talk about things like finance and started to talk about things like resident voice and and so those things, sort of, there was an apex. And as we continued to walk the Evidence to Success framework in Providence, and as we continued to develop our functions as a collective impact backbone, we really pivoted into what we're calling a nimble intermediary. And what we realized very quickly is that the functions that you have under a collective impact backbone framework, things like convening and aligning work and communication strategies and a common data set, were really very much what larger intermediaries were doing in academia, right? So there are large institutions that have these big centers of evidence. And we felt like we could marry the two. And as we continued to implement the Evidence to Success framework, continued to use, Eileen mentioned the Youth Experiences Survey. It's a core set of data that's administered every 2 years. It's risk and protection, and it's youth voice. And then we use youth voice and community voice to set the priorities around what they want to see and what they want to do. And as we continue to walk those things, our residents helped choose programs that tracked specific outcomes. And we became this intermediary that provides really key sets of functions, right? So we do project management, we do data, and we curate this set of data, the Youth Experiences Survey. And we provide TA nationally to folks. And we bring people together for finance. We convene. The trust that we had as a convener early on in the collective impact world carried over to the work that we're doing as an intermediary. And finance is really sort of there's a couple third rails in evidence and in collective impact. And when you bring people together to raise money and collaboratively raise money, sometimes partnerships head in the opposite direction. We worked very hard because we feel that finance was an integral piece. Bringing together to raise dollars around a core set of priorities was very important to us. So we continued to build out those functions, and right now we have research partners at the University of Washington, at Penn State, and at Brown University who incubated us for over 2 years. So we have partnerships in the research, and we've continued to define our functions as an intermediary. So it was this transition from what we were to where we are now to a place that's very much focused on evidence, from the Youth Experiences Survey to our portfolio of 5 evidence-based programs that we support in different ways, that we raise dollars for. And what we're very focused on right now in our work as an intermediary is culturally relevant implementation. And programs are not right fit is a term that's used pretty frequently in evidence-based work. But it's not just that. Was the program designed for a specific population? Was the program designed and the work designed for a community of color? And does it track to outcomes that our residents have told us? And so it's, again, continuing that journey from 2011, 7 years to where we are now, refining those functions as an intermediary, using the strength that we built as a collective impact backbone, and thinking about how to scale evidence locally and nationally as well.
Well, both of you have really talked about partnering throughout thinking about developing evidence, building evidence, using data. Ruth, your work is all about partnering as well. Could you talk a little bit about how your partnership works and how you work with the Philadelphia School District and others?
Sure. So I am from the Philadelphia Education Research Consortium, or PERC. We already heard from John Shamanico about HERC, that's the Houston, and there's also a BERC, so there's definitely an ERC thing going on. And what we do is we are in education research practice partnership, where we are working with the public education sectors in Philadelphia. And that is plural, because Philadelphia has a large charter school sector, fairly fragmented, actually, many sort of mom and pop type schools. So our mission is to work with the School District of Philadelphia, which serves 70% of the students who are in the public schools in Philadelphia, and the charter sector, which serves the rest of the students. I would have to say, so we're trying to work with both of those groups. We are based at a education nonprofit organization, which is different from almost every other education research practice partnership. Many of them are based at universities. There are some that are based at research firms. But being an education nonprofit is a bit of a unique position. And what we are trying to do is to engage the research resources in Philadelphia. It's a very research-rich community. There are several graduate schools of education, and we are trying to pull folks together who want to work in partnership into this kind of work. We are very fledgling, that being said. So the way that we have been trying to work is to we've already heard this talked about, is to build relationships and build trust and demonstrate value. So the kinds, and we are not the only partnership in Philadelphia. There are others who sort of use the term partnership. There are others who, as individuals, maybe don't claim the term partnership, but in fact are operating in partnership with the school district. So we have to sort of navigate in that environment as well. So one of the ways that we have been working, and I have been working to sort of develop relationships and to really listen, as we've already heard about, to understand organizational routines, to think about how the work that we are doing can fit into and support those organizational routines, and in the School District of Philadelphia, support what is a fairly large research and evaluation office of about 15 people. I spend every Friday there. I work there every Friday at the district. We have worked out a research agenda around high schools. And one of the things I was really looking for, and I think this is important in research practice partnerships, is to look for questions that are not just sort of intellectually interesting to practice partners, but are really sort of ripe for having some movement and some effort put into that from a policy and a practice and a sort of priority side. So high schools is that area in Philadelphia right now. And what we are working on is a set of descriptive studies on ninth grade, different aspects of the ninth grade. The district is working on putting a dashboard together so that people, that principals and other school staff can really track ninth grade performance. The descriptive work that we are doing, looking at predictors of different outcomes, is informing that dashboard and is informing the professional development. So there's more I could say sort of about partnerships and what districts are looking for, but maybe you'll have that question later.
I think so. Well, and maybe, so the one partnership with that you're working on with the school district and everything, and the high school descriptive studies, how did you come to agree on that as the right tool and product for sharing evidence?
That came about through listening and asking questions, not about what research do you want to do, but about what are the priorities that the district has for school improvement. What does it want to focus on? And so it's really that kind of a conversation. And then the question sort of follows, well, how can research help to inform that agenda? I think Vivian was right when she said that research can bring people together. It can help them to define what that common problem is. It can help them figure out where are some places to focus. When you're looking at a situation where, 1/3 of the 9th graders do not accumulate enough credits to be promoted to 10th grade, and there are lots of students in the school district of Philadelphia, that can seem like a very large problem. One of the things that research can do is to sort of help cut through what can seem like an overwhelming problem and identify some places for sort of short-term work, medium-term work, and long-term work.
Great, thank you. And Matt, I think we've this carrying on this theme of relationships. I mean, how have you thought about ways to make evidence more relevant to the programs you work with?
That's a great question, because it has to be relevant. And I think if you're talking about, I heard some context, like what I call like an enabling context, and how do you make the soil around where you're doing your work fertile so it can run? I mean, there's simple answers. One is like visualizations. One is, making sure that you're engaging the people whose voices are actually in the research, right? So I think, we always say sort of, behind every piece of data, there's a person, and behind that person, there's a story. And we have to engage folks in the story that got them to that data set. And so for us, we've been on a quest for several years now through a continuous process of taking that data out to residents and to our community members and having them either echo the priorities that they set long ago or ones that, are new to them as well. And when I use the word nimble, is that are you designed, if your community or residents change what they're prioritizing, can you make that pivot to support the work? And that's what I talk about when I use that. And so I think the easy answer is visualization, but when residents tell us that, in our neighborhoods in Providence, they have elevated rates of anxiety and depression from traumatic exposure, we got to go act on that, and our work is to go raise dollars to put evidence in place to continue to deliver that. And the first panel talked about what's an early win, and I think somebody else mentioned an early win. So our goal was to take those priority outcomes and those priority risk factors, right, that residents told us about over the course of our ongoing processes around that data and go deliver for them. And so when we could come back and say we secured funding to deliver a program that you selected, that you identified as elevated risk, and here are the results, right? It's mitigating traumatic exposure, it's decreasing, the effects of PTSD in students. That's how you make it live, that's how you make it sing. You take it back and you make sure to feel that accountability, that sense of accountability that we feel, to turn the results back to the residents so that they're coming to us and like, I run into folks at meetings and things, they're like, well, how's CBITS going? Cognitive Behavior Intervention for Trauma in Schools, how's CBITS going? And so I think engaging folks on an ongoing basis like that, that's how you make it stick, and that's how you build that traction, and that's, how you get people engaged in those results. And I just want to say just a quick pitch around language, and even the survey that we use, it's, there are words. It's tough. Research language is tough. And how are you bridging, when you're in front of 50 residents and you're talking about, things like delinquency, early delinquency, and you're talking about, poor parenting skills or poor socialization, right? Like, who's doing that translation and who's having those conversations, right? And I think, it's about getting to that layer and level of expertise. I'm not the expert. Our residents and the people who experience public systems and experience, the risks and the challenges and the opportunities on a day-to-day basis, how are we accessing that expertise to help us make decisions as well? And that's how you build traction, and that's the sustainability too.
That's great. Thank you. I'm gonna turn a little bit with Lily in terms of building evidence. So that's another key component of evidence-based policymaking, is actually developing and building that evidence. And you've been on the front lines of evaluations, having evaluators come to your organization, having to manage that process and understand it and be able to build support within your organization, and for the participants that have to answer a lot of questions or provide a lot of data. And there's just a lot that goes on with evaluations. I know, because I'm one of those people that comes in and and does that, and we, recognizing that burden, but then balancing it with the value of what you're producing. Could you talk about your experiences and what you've taken away from that that could be useful for others?
Sure. So we're in the middle of 4 different evaluations right now. By the way, don't do that. That's really not smart.
First piece of advice.
Yes, that's a terrible idea, to do 4 evaluations at the same time on different things. So we're in the middle of 4 evaluations that are on, really, 2 of them are on the same thing and 2 are on completely different things. And the reason we're doing all this evaluation work is, as I said earlier, everybody wants you to use evidence-based practices. At least for the population we serve, there aren't a whole lot of evidence-based practices out there in the world. There aren't a lot of organizations who have had the money to do RCTs and the time and the inclination, maybe the time and inclination. But there also aren't a lot of, quite honestly, organizations who serve the same people we do. We serve kind of a unique target population. And so we've been forced to kind of create our own evidence or to rely on administrative data. So I'll say this first. I live in the world of criminal justice data and in healthcare data that's tied to public systems. If anyone here is from the federal government and funds those data systems, put more money into them, because they're all terrible. Our biggest challenge in our criminal justice evaluations is that the administrative data is horrible. If the local criminal justice agency can't tell you where the kids in their custody are, or if they've recidivated, that's kind of challenging. And Massachusetts has pretty good data. We work in a couple of places. Massachusetts has pretty good data. And still, the data's challenging. And so if people won't rely on our internal data and you need administrative data, getting that administrative data to work with agencies, and by the way, getting agencies to have permission to get access to it, because just getting access to administrative data took forever for us, for young men's programming. The other is getting staff to really buy into what you're doing, because if you're creating your own data, staff have to believe that this is important, because if they don't, they put terrible data in your system, and then you get terrible data out of your system. We're pretty, at this point, we're pretty good at getting staff to put data in, and we're pretty rigorous about it, to the point that staff could, there's sort of real consequences if you don't enter data and we don't see, and you can tell if data's right, because we know what it takes to get a kid through a change process, and if it looks completely off like that regularly, it's probably the data and not that you magically have found the 15 kids who can move perfectly through something. Our kids don't move perfectly through anything, so when that happens, something's off. So I think those 2 things are really important. I also think I'm going to speak for the little tiny nonprofit community out there in the world and say, if you actually want us to produce data and produce evidence, you have to help us. You have to give us resources. Everybody in the world wants nonprofits to have data. I think the 3 foundations who pay for it were just sitting in front of the room. Nobody wants to pay for it, but they all want you to have it. So you have to magically find money in random places to try to put together data. And most nonprofits, quite honestly, don't have the capacity to do that. Nor do they have the capacity to staff an evaluation. And so the last thing I'll say is, if you are the researchers in the room, think carefully about what you're asking agencies to do before you ask them to do it. and make sure they understand the design and what you're talking about. So we are part of an evaluation, which is one of the things that keeps me up at night regularly. And I'm pretty good at evaluation data and can understand it and can have a conversation with researchers. But several years ago when we started this evaluation, I'm not sure I understood what we were getting into, nor do I think anyone else at Roca understood what we were going into. And we're, as far as nonprofits go, we have a pretty good high level of capacity. And we're in an evaluation that we should have never agreed to. By any stretch of anyone's imagination. And now I have evaluators looking at it going, why did you say yes to this? Because nobody in the room told us we shouldn't, and we didn't know better. And we're not an unusual agency. There's just agencies who don't know better. And so if you ask them to do something outside of what they should be doing or what their work is, mostly all you're really doing is taking away from them doing good work and at the same time producing no good evaluation results on the back end.
I want to follow up with that because a lot of times federal grant making especially has evaluation strings attached. How could that process be made better from your perspective?
So I'm going to tell a federal story first, and then I'll. So about 8 years ago, I was at a meeting at NIJ, and we're talking about evaluating Roca's data, and we had been having a really hard time finding someone who could tell us how to do a rigorous evaluation because of how we do outreach and how we get kids and how we determine if they're eligible. It was really hard to figure out where to randomize and how to do outreach. Yep. So we had this meeting at NIJ, and they said, well, we can evaluate your model. You just have to change this whole first part of the model and how you do outreach. And we were like, but that's the model, right? So that's the challenge. A lot of the federal dollars want you to fit into a very specific box, or they want you to fit, and this is true for both programming and evaluation work, right? We are huge believers in brain science. I work with kids up to 25, and I still call them kids because they think like they're kids. Big believers in brain science, but when some of the federal agencies say to you, you can be involved in the juvenile side of our work until you're 25, unless you've ever touched the adult criminal justice system, and then you can't. Which, by the way, is more than one federal agency that has that rule. And it's a rule for programming, it's a rule for research. Well, you just knocked all our kids out of the research realm, because in every state we work in, you're an adult before you're 25 for criminal justice. Can't research their work because nobody will pay for it. Because and God bless you for believing in brain science. I think it's awesome. But if you don't follow the rest of the steps along the way to get to what's practical, then it doesn't help that you've adopted this great thing, and it is a great thing. I think that kind of answered it, hopefully.
Oh, yeah, sure. There are always challenges. So I want to turn to communicating evidence and really trying to understand how to get evidence, continue to understand how to get evidence into practitioners' hands. And I'm wondering, Ruth, if you can talk a little bit about the What Works clearinghouses and clearinghouses in general, and how they can effectively get used at that local level. I think we touched on that in the earlier panel, but you, having been at Department of Education, have firsthand knowledge, and so we'd love to hear from you on that.
Okay. Yeah, so I guess the first thing I would say is that the What Works clearinghouse, and this is true for most clearinghouses, not all, focuses on effectiveness research. So it focuses on just one type of research, causal research. So what I observe is that districts are interested in a range of research. I just want to say that right up front. So there's descriptive research. I see a lot of interest in implementation research for all of the reasons that were discussed in the previous panel and also a few minutes ago. I see interest in quick turnarounds, causal studies. I see interest in large-scale causal studies. So So the clearinghouse and clearinghouses are just one sort of slice. And the way that I have observed the What Works Clearinghouse, which is the sort of relevant one since I'm working with the school district, as being used and relevant is really in two key ways. One is the clearinghouse produces practice guides. These, I know from being at the Department of Education, are the most downloaded product from the What Works Clearinghouse. I observe that there is a lot of interest in hearing from panel members, hearing about practices. It means, these practice guides, you don't have to go buy stuff, right? It's about practices that you often can implement with what you have. Interestingly, there are even schools who sort of come upon these things, and we'll talk about them, sort of just from encountering them on the web. So I think that that's one thing. But another way that I think clearinghouses are incredibly important and are underappreciated in a lot of ways for their impact in the local level is the fact that they have a vocabulary that they use and the fact that they have standards that people can refer to. And so I think there's something really important. Before those clearinghouses, there wasn't so much this common vocabulary about meets clearinghouse standards with reservations, or this sort of sense like, well, we should have a study that meets this, or will we have a study that meets this criterion? And I think that that's important for districts sort of talking to themselves. It's important for districts talking to evaluators who come in. And what I see that the School District of Philadelphia has done is sort of used that terminology to understand and help the people who are coming in wanting to do research to sort of say, what kind of a study is this? The other thing that I think it can do is it helps to think about how to incorporate evidence of effectiveness into routine processes. And I'll give you one example of that we worked on. And this is like, when you ask about the kind of work that we do, sometimes we're doing sort of producing original research, and other times what we're trying to do is to come alongside and provide some additional sort of hands on deck to think about how to incorporate studies that have been conducted elsewhere into processes to inform that work. So one of the things that we did in the past year was to incorporate some evidence requirements into an IT procurement for approved vendors, providing a whole range of different IT, generally speaking, related things. Could be platforms, could be software. These districts go through these, every couple of years, coming up with a list of approved vendors. And so we incorporated some requirements. You will get X number of points additional if you can provide evidence that meets this moderate standard. And it was fascinating to see the vendors come in, and some of them really told us all about the What Works Clearinghouse standards. Other ones sort of like went through practice guides and said, see, here's how our product aligns. So I think there's a lot about sort of the tools, and later on this is going to be my argument about sort of what the federal government can do, is it sort of provides some tools and standards so that people don't have to sort of reinvent the wheel and can kind of talk to each other using a similar vocabulary.
Continuing on thinking about where one gets evidence to inform their programs, Matt, I think you've talked about that some, but are there some barriers or challenges that maybe to finding evidence that's really relevant, or are you finding some really great resources that can guide you?
My resources, I think, would be my preference. I think there's two questions. One, how do we narrow it for us in Providence is, again, I'll go back, what have residents and community partners told us? And that's our true north. We stick to that. We keep it narrow. We continue to update it. Is it changing, right? So it's that consistent communication around the same set of outcomes on an ongoing basis. And then on this end, the foundation panel that it was up before, and Pew results first. I mean, it's just there are pieces that are out there, and it's not necessarily expansive research. There's information in briefings. There's information on what's on the horizon, journal articles. And I think for us locally, one of the things that we're really thinking about is how do you scale evidence? And so for us, we're trying to see, we're trying to figure out what does that look like, because all of this is fantastic, but how do we replicate it, and how do we start to overlay the future needs with what we see coming down from the federal government in terms of opportunities to access resources that are sort of steeped in the nomenclature of evidence or the demand for evidence in and of itself. And so I think from our end, we stay very focused on student outcomes, well-being outcomes, and sticking very closely to that, but on an ongoing basis getting feedback to make sure we're on the right track in terms of how we're raising dollars and how we're doing our work. But for me personally, I'm looking at places like Pew, I'm looking at the foundations, I'm looking at what are the conditions that we have to create nationally to scale the good work that's going on. And I think that for me, that's very much what I'm thinking of, and what are the capacities that exist nationally that are already there, that need a little fertilizing and a little cultivation to get to a place that can be, these intermediaries that support the implementation of evidence. So it's, like I said, it's sort of that dual role. It's looking at well-being outcomes, but also looking at the field and looking how do we sort of continue to advance the field by thinking about, where else can we do this in this way?
Can I add one thing to that? So the other thing about looking at evidence and creating data is being willing to look at different sources. And so one of the evaluation that gives me headaches is also really interesting. So it turns out I can go to 3 different data sources in one state and get, for the same piece of information, and get 3 slightly different answers on the same piece of information, one of which is incredibly helpful, but you have to know which one it is, right? So I talked about probation not knowing where their kids are. That's actually not true. What's true is the state that I'm working in doesn't necessarily know in the state's data system where they are, but if you went to probation and asked their caseworkers where kids are, they know exactly where they are, and they can track them all down. But the evaluator has to know that there's got to be another way to get to the data besides the first one you started with. And I think that flexibility in creating data, the flexibility to say, the system we thought was going to work isn't exactly what we need, and maybe we need to tweak that to be able to get to better data. Not to say a program does better or does worse, but to say I can get to a more accurate result if I adjust the design a little and I adjust the data source a little to get to something that's a little more accurate. I think as you're creating data, that's also important to sort of think about.
I just want to do a quick reminder. We are going to be taking questions at events@urban.org as well. We'll start some Q&A here soon. But I do want to, circle back a little bit to implementation research, because we do talk a lot about effectiveness studies. We talk, we want to know the outcomes for participants and really talking about that. But good implementation research can really help guide other people on how to do the good work of others. How are you using that in your work?
So almost all of the work we do is around implementation research. We do some outcomes impact stuff. But to me, the more important thing is the implementation work, because it's about how do I take those outcomes and translate them into what worked? Like, what's the thing about the model that gets someone to change their behavior? What's the thing about the program that gets a young mother to keep a job and get off public benefits? And what does that cycle have to look like? And so the implementation research for us is really important. Mm-hmm. I also think it has to be done in a way, I'm going to throw my boss under the bus a little bit. We had a meeting with our evaluators the other day, and my boss looked at them and said, you have to talk like Lily's not here, and you have to talk like you're talking to someone who doesn't understand anything about evaluation. And I think part of the thing about implementation research is you have to assume the people you're doing the research for aren't researchers, and we don't necessarily understand research language, and we don't necessarily understand those I know what you're looking at and I understand the model, so talk to me about it in language that I'm going to understand it. Also, because if I'm going to go advocate to get more people to do this, I need to have that language, and I need to have it in a way that my entire staff can understand it, that my community can understand it, so I think that's the big challenge. We partnered with several researchers before we landed where we landed, and some of it was, there was literally a complete inability to translate from research language into, for lack of a better expression, into English. So that the people that worked at the organization could understand what you were talking about.
Do others want to speak to that?
I think it always comes back to me. It's so from a programmatic perspective, we think about you did this program this way and it's delivered these results. And I think that what we haven't talked about in it's the one that local context matters. Wherever you're doing something, the contextual reality of where it is, and if you want to go pick it up and put it somewhere else or think about what it means to do it somewhere else, that context is different everywhere. And so it's never one size fits all. And I think one of the things that I'm constantly pushing on is this isn't a gold standard. Like, it can't be this static thing that nobody pushes against in terms of what's delivering these results. You constantly have to be saying and driving towards, like, this worked here, but here's how we're going to do it. And there's safe ways to do that. And we're always working with evaluators. We're always working with program developers on our end to push those boundaries. And there are some times when people say, you're so far outside, you're going to have to get another evaluator to come in, and I'm okay with that because we're doing that. But there are times when you're just tweaking things. You're looking at a question that evaluators don't always ask, like, how engaged is somebody in something, right? Like, how engaged? What is their attendance? Do they want to show up? And there are just these gaps that are missing in our research oftentimes, and it's so often it's plugging a piece in that's missing, or it's adding a piece of local context that's not there, or it's reminding evaluators that this is what matters here and this is how it works here. And it's not going to change the whole design, and it's not going to change the results or the outcomes. But if you want to take it out of this condition and move it somewhere else, there's got to be a level of adaptability that is inherent in the people who are asking the questions and the people who are doing the work as well, too.
You bring up a really interesting discussion point in terms of driving the research questions and how you all are doing it within your organizations. And I know, Ruth, you're more the translating what the research interests are from practitioners. Could each of you speak a little bit about how you're asking the research questions of researchers to address, and Ruth, how you're translating that?
Could you say that question
Sure.
again?
I'm looking for how you're working with your local partners in terms of developing the research questions and what they're saying to you and how you're putting that into research terms.
So let's see. So with our local partners, I think some of the things that we are trying to do, I mean, we serve as a matchmaker as well. So one of the things that I'm doing in my sort of listening and being around in the district is trying to hear about their particular challenges or the kinds of things that they might like. And sometimes they'll sort of have to be able to express it. Like, I would really like to have an early warning system for long-term English learners. Interesting. I can see how you might, I'm not sure what that would look like exactly, but I can understand how you might want something like that, and I can understand how it would be different from an early warning system for, ninth graders falling off track or something. And then what we try to do is to work with some research partners to sort of say, here's the kind of thing that they're interested in. And I'm trying to think about the kinds of methodology and also the kinds of content expertise that people bring. And this is one other thing I really want to mention too, is that when researchers work with districts, they have to bring something that that district does not already have. And in some cases, that might be analytic expertise. In other cases, it might be methodological expertise. Sometimes it's content expertise, and some of it's sort of all of the above. In the case of Philadelphia, there's a lot of analytic expertise. So what has to be brought is content and really high-end methodological expertise. So what I sort of find myself doing is trying to bring these different folks together that I know. And sometimes they're in Philly. Honestly, sometimes they're outside of Philadelphia, where we try to do sort of the matchmaking. And some researchers have a pretty good ability, I think, to, they sort of are able to sort of interact better with district folks. Other times they need a little coaching, you know, like, let's talk normal.
Thank you.
Let's talk normal. Also, let's do a little listening here. I know you're enthusiastic and you want to jump right into and tell them what to do, but maybe you just need to sort of ask some questions instead. So I guess there's some sort of like coaching around people skills that we do as well.
That's great. And how about, Matt, for you in terms of the research question, which is, you know, jumping in and asking what research question do you want to address to programs is not the right way to go. How do you get there?
For us, I'm very opportunistic, right? So it's not about necessarily launching another trial or a big launch, and we have multiple different sort of evaluations that are happening right now, but just sort of a quick story to make this point is that we're scaling trauma programming, evidence-based trauma programming. We're a SAMHSA grantee, a Category 3, and so we're supporting the work of clinicians doing trauma groups in schools. And there are these screeners, right? Very simple 17-question screeners that are done as part of the program. And we started to collect these screeners, right? It's a first layer in terms of student participation. And we started to get more and more and more of them, and I started to say, okay, well, so we have an in-house CQI person too, fantastic, right? And so we gave them to her and we said, well, let's start to look, like let's start to figure this out. And so in a very quick way, within several months, we were able to collect almost 1,700 of these pretty simple trauma screeners, right? And we were able to start to look at prevalence rates around specific kinds of trauma. And what we found out is 80-90% of the students in some of our samples were grieving, right? Like they're grieving the loss of somebody, and where are they going with that grief, right? And so for me, the story is, and it's about loss and separation, and when you think about a more universal Tier 1 intervention, you can take this data and say, look, we've got to make investments in things like grief and loss and separation. And it wasn't, I didn't have to call in another person to ask another question because I'm not a researcher and I'm not an evaluator, but we took what folks had told us they're interested in, we took what was in front of us, and we brought it together, and now we're running larger samples across the district and other districts now too of, you know, a sample of universal, what I'm calling a universal sample, where it's just whole classrooms of students answering these screeners and overlaying it with the students that have been identified by schools and saying, they need something. Can we screen them? Can you find out? And what we're finding out is that the overlay is incredibly similar. Like our kids who are internalizing their experiences and our kids who are externalizing are experiencing the very same thing. And so it's about being opportunistic in the moment, and sometimes there are things right in front of us that we can catalyze and move forward and put a little bit of energy and effort around when we're listening to folks, right? And when folks are telling us what's important to them, and then pushing out data and information and something that can turn into something bigger, but again, sort of making it relevant in the right now by listening to what folks are interested in and answering those questions really quickly.
I mean, it sounds, what you said before, the nimble intermediary comes through there. And I, you know, Lily, you all have an evaluation and learning manager. And
he's a department by himself. Now he has 2 staff at this point, but we're probably a little different because our research is all about, we're very self-centered. All of our research is about us. We think we know how to work with a certain group of young people, and we want to know if we're doing it. Mm-hmm. And we want to know what we need to change to make that better. And so our research questions are always about, so the newest thing we're looking at is we worked with Mass General Hospital to create a CBT curriculum specifically for this group of young people. And so the research project is working with an outside evaluator to look at the implementation of that CBT curriculum. And if John from Arnold is here, thank you, because they're funding our evaluation. There you are. Does this work first at Roca, and then can it work somewhere else? And so, and I like really big thank you to Arnold, because normally Arnold says we want you to do an RCT, and we were like, we don't want to do an RCT on this, because we don't want to tell kids at Roca they can't have CBT. And so we're testing it. We're using some quasi-experimental, I can't explain design, to test this model at CBT, at Roca, to see if it works. And if it does, we'll then go elsewhere and see if it can work with other groups of people, right? But it's about, for us, can we get kids to change their emotional regulation? The research is interesting, but it's really, did kids' emotional regulation change? And does that help keep them out of prison, right? Because what we think, knowing young people, is the reason a lot of our kids screw up is because somebody, for lack of a more polite expression, pisses them off and they react. And where you and I have learned to take a breath and think, they haven't, right? So does CBT fix that problem? And can you use CBT to make a kid take a breath and think about the consequences before you pull out a gun or do something else that's incredibly stupid, right? But all of our research decisions are based on things like that. It's like, if you get someone through transitional employment, will that help them keep a job? Because what we know is kids do better if they're working. So how do you get them to go to work? So I guess we are our own little community, right? Like, our kids are our community. But it's all about, what do we think is going to help those kids?
That's great. I want to bring it back to the overall topic of the session this morning, and talk about the federal government and as well as foundations who are sponsoring a lot of these evaluations, a lot of this research. You know, and they do, evaluations can do lots of things, right? They can be really big, they can be really small, they can provide different types of technical assistance on new ways to do programs or particular interventions, and then, you know, all these kinds of evaluations may eventually get into a clearinghouse or are shared in a lot of ways that others can use them. I'll start with you, Ruth, but others jump in. What can the federal government do to help local agencies and programs really use evidence and use it more easily?
Mm-hmm. That's a great question. And I have so many opinions on this that I'm really excited to share. Okay. So I'm going to talk about the education context. And I think clearly one of the things that they can do is continue support for partnerships, and to do this in multiple different ways. If you look at what the Department of Education has done within the past 10 years, it's actually supported these research practice partnerships pretty heavily. The major source is through the Regional Educational Laboratory Program, which is funded at $54 million a year. And not everything that they do is going into a research practice partnership, but lots of it is, I think, to really good success. And I'm going to talk about some of the things that I think have come out of that REL program that really help on the local level. So I think thinking about all of the different vehicles that you have as a federal government to support this kind of work is important. There is also, through IES, there are grant-funded research practice partnerships, and there are lots of them. And I think that's a really important additional funding stream, probably could be increased. But in addition to funding, there are other sources of funding that the federal government puts out in education, has an education, Title I, Title II, Perkins, it looks like it's about to be reauthorized. All of those funding streams include money for evaluation. It seems to me that one of the things that the federal government could really be pushing on is helping state grantees and sub-grantees to think about how to use those evaluation resources and those research resources in partnerships. And that would be a way of supporting external researchers and also building internal capacity. I think that's a whole area of work and thinking and support that has really been, that it has a lot of potential, and I think has really been sort of under conceptualized and underacted on. Okay, I also think that the federal government could specifically support researchers based in state agencies and school districts. So one of the things I become sort of passionate about working at the School District of Philadelphia is seeing how there are often researchers embedded in those agencies. These are natural connections between research and practice. And so it's not as if somehow education agencies have only non-researchers and external partners have only researchers, and somehow there's this great chasm where there's just no sort of bridge between it. There are often researchers, but unlike what you might call sort of data stewards, that have like the National Forum for Education Statistics, for example, where they can all come together across states and they can talk about some best practices. They put out fantastic sort of pieces about their craft knowledge and are really building up that profession. Researchers who are embedded in agencies do not have those natural connections. There is no sort of active home for them right now. I think the federal government supports the National Forum for Education Statistics. It could do something for agency-embedded researchers as well, I think. Okay, a couple other ideas. So another thing that I think they can really do is developing tools and models. And this is something that I could sort of see when you're at the federal level. You're like, yeah, that's great. We're producing these tools and models. We've done these software, and we've done, we have these sort of reports that we try to, through the REL program, for example, that we try to make sure are written in plain language and are kept short and all that sort of thing. At the local level now, where sometimes I feel like kind of like out in the hinterlands a little bit, those reports that come out, like those REL reports that come out, are enormously important as models. Like this is something that we could do. Oh, some other agency did this. Oh, we could do that too. And I think that there's software, RCE Coach that the department has put out. I mean, so I think it's a lot of really thinking about what are those tools, surveys that can be shared, different kinds of I don't know, examples of just how to do different kinds of analyses. That's the kind of thing that, in some ways it's kind of like letting 1,000 flowers bloom, but what you're really trying to do is somebody out there else is going to find this useful. So being really intentional about how to make more out of those particular research projects. There are also tools that support evaluation. So I'm thinking particularly about tools that were developed to support investing in innovation evaluations. And I know I can see Mary Hyde. Hi, Mary, from the Corporation for National Community Service. And Mary and I have talked about sort of, the technical assistance resources that CNCS put together for their tiered evidence competitions. I think taking these resources that were developed to really help those evaluators put together really good evaluations and making those things publicly available and helping people to use them is incredibly valuable. I know CNCS has a site. IES has some of the tools that were put up from investing in innovation, but I think there's a whole lot more that could be put up and made available. Like, here's how you do an evaluation plan. Here's all the kinds of things that you would need to kind of think about as you put together a rigorous evaluation. And finally, I just want to say one more thing, is that one of the things that I think is important for especially science agencies in the federal government to think about is that there's a value to research practice partnerships for research use. And in the end, that's what we want. But I think it's also really important for research agencies to recognize that research practice partnerships are more than like hopey-changey, trusty relationship, blah, 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 right? This is all about, think about the kinds of research insights that are coming out of research practice partnerships. And it's important for science agencies to really take account of that. When I look at things like about what we know about time to proficiency for English learners, where do we really know that information from? We know that from research practice partnerships. If you didn't have that stuff working at the local level, You would be using, I don't know, big national surveys to try to figure that out. You would be, that's what we used to do in the past, right? There are so many insights, information about sort of the 9th grade and progress through graduation. Where has that come from? It has come from research practice partnerships, and I think there are other examples of that. And that we really need to, and I'm sure it's true in other fields as well, so we need to look at the real and be aware of the substantial, generalizable intellectual contributions from research practice partnerships. And that's what I have to say about that.
Thank you. Before we go to Q&A, I just want to give Lily and Matt an opportunity to reflect on Ruth and Ruth's comments.
So 2 things. One, I just want to say thank you. We are not the normal organization to be sitting at one of these panels, so it's always nice to have the opportunity to speak on the behalf of sort of nonprofits who are just out there in the world trying to figure this stuff out. So thank you. I think the place the federal government could be really helpful is in helping nonprofits build their capacity to engage in evaluations, either by helping them build capacity to have better performance-based management systems, not always self-serving. I probably wouldn't ask for this money. But I do think for most of the nonprofits I know and that I work with, the biggest challenge they have is they don't have the capacity to do this, and then they end up getting in over their head when they do get involved in evaluations because they don't have that capacity. So one would be that capacity, and the other is when you are funding evaluations, actually funding the time and energy it takes on the part of the nonprofit and their staff to engage in the evaluation process. Because if I have staff that are devoted to evaluation, essentially means I am taking them away from service delivery, right? And they can't do, and somebody needs to do that job. And so being able to give agencies the resources to be able to fully engage in an evaluation and continue to do their work at the level. Because what most nonprofits do is they sort of go, well, you can do this and you can do your job at the same time, and that often shortchanges their actual work. And so the ability, I think those 2 things, I know nothing about all the clearinghouses and all that other stuff. I'm useless in that regard. But from the perspective of just building up capacity, giving people and agencies the tools they need to actually collect their own data, understand their data, and use it would take them miles.
And Matt, what would you advise the federal government?
So I call it infrastructure. I think, for me, I'm going to flip it, and I'll say it's a little bit on us right now. And I think we have to learn how to use evidence better. And I think we have to mobilize existing networks at the state level and the local level, and bring existing partnerships together to leverage what's in front of us and what's coming down the pipe as well. Families First is a great example of what's coming down the pipe. It's going to fund evidence. It's going to fund infrastructure. And I think we have to be a little bit out ahead of that and thinking, how are we bringing networks of people together to start to leverage evidence? And that's your public systems, your child welfare, your health departments, your school districts, your housing systems. And they need to be supported to use evidence better. So from an organizational standpoint, yes, I think about it from a public system standpoint, and how are there existing networks already at the state level and local level who could come together to start to leverage those capacities and get coached, some light coaching, some light rethinking, some light strategy, right? To come together to become like, this is our consortium, this is how we leverage money, this is how we raise dollars, this is how we execute on evidence. And so I think the feds are using the language. I think they're dropping it in. It's a big Wild West. When they say evidence, it ranges from here to here, which is okay, but I think we have to mobilize at the state and local level to better implement and better use evidence ourselves, and think about what capacities we need to build to better access those dollars and better put those dollars to work for better results.
Great, thank you. I'm going to turn to the audience here and just do a quick reminder for those watching the webcast. You can ask questions at events@urban.org. But for the audience, questions? You have one right here, Jordan. Thank you.
So great panel. Thank you guys, really appreciate it. I see one of the new frontiers of evidence-based policy is around replication, and I think each of you sits in a really interesting space. Lily, you guys are in the process of replicating, transporting to Baltimore. Matthew, you guys are in a place in which you are taking programs that have worked in other places and thinking about how they apply to your particular context. And Ruth, you have both thinking about this from a federal level and from Philadelphia, and how it looks in that local context. So would love your reflections on each of your experiences in thinking about replication.
I'll go. I think that's a great question. And I think that that's an example of where sort of what is a big, important issue that's being talked about in science circles, right? That there's concern about certain results just don't seem to be replicating, really meshes up with an emphasis on conducting local studies to see to what extent something is impactful in this context. So I think that these are actually things that can work hand in hand, where you can have, I think, sort of different constituencies who are maybe coming at it from different angles, but have similar interests. I don't know of anything right now that's being replicated in Philadelphia, so I'm just sort of talking at a higher level. But I think what we could also see is that there's a relationship too between the wanting to replicate and then also wanting to adapt a little bit, and it provides you an opportunity to do that. I believe that IES is funding or has changed its goal structure up a little bit. I'm sorry, I'm kind of like half paying attention to that, so you'll have to confirm if that's true. But I think it's really changed it up to sort of emphasize replication a little bit, and it seems like these kinds of things could really come together.
From a programmatic perspective, I talked a little bit about local context, which is critical. I think I'm doing some coaching in other sites around programmatic work as well, and it's fascinating to be able to support other places in their scale of programs and practices. Where is their rigor coming from? Is it coming from implementation teams? Is it coming from consistent practice? And I think when you really sort of peel everything back, you can get to a few core practices and principles that get you to those right places. And are you holding true to how you think about program implementation and prioritize data? And I think there's a great opportunity out there to support other places as they sort of come online and they think about programs and they think about practices. And it's making those practices accessible, because I think once we demystify what evidence is and that it exists in this ivory tower of research in academia, I think it becomes much more approachable. And I think that's part of the work. And we use the word translation, but it's more than that. We've got to show results. We've got to show why they matter. And we got to show that it can be done here the same way it can be done in Selma, the same way it can be done in Salt Lake City. So I think part of that is in how are we working and what are those consistent core things that we're using to replicate, and how are we looking at the results in other places as we do that, because those contexts are different as well too.
So Roca started out in Chelsea, Massachusetts. And we're now in 5 places in Massachusetts and Baltimore, Maryland, as of 3 weeks ago. Look at my watch. Feels that fast. We decided that we have a model we think works. We have a decent amount of evidence that says the model works. But we think there are core pieces to the model, and so I do think there's local context. Baltimore is like no other city we're in. The crime rates and other things going on in Baltimore are like no other city we're in, and we know that. And so we've adapted the model to address what we think we're seeing in the community. And quite honestly, because we're who we are, we will continue to adapt the model as we grow the program in Baltimore to meet the needs of the community. We do think, there's like 4 or 5 pieces of our model that are key to making the model work. And they're about building relationships with young people and doing certain things, and we think you can do that anywhere. The context in which that exists looks different. It looks different in Lynn than it does in Boston than it does in Springfield, because Lynn and Boston and Springfield are very different cities. And again, Baltimore is completely different from that. And so I think we track our outcomes in all of those places. We track engagement of young people in all of those places. We will do the same thing in Baltimore, and we will continue to sort of tweak the model. And so the easy example is about 4 years ago, we started working in Boston. Boston is Boston proper. We always sort of worked in East Boston and other places. We opened a site in Boston, and it turned out 40% of our kids in the Boston site can't come into the building because it's too dangerous. Because they're either active shooters or active targets, and they can't be in our building. So that's interesting. It was really interesting for us as we learned it, and realized that 40% of our kids couldn't be in our model the way we deliver our model. And so we adapted how we deliver the model. And it's still the same transformational relationships. It's still the same stage-based programming, but it's delivered in a different way to meet the needs of those young people in Boston. We actually run the model 2 different ways in Boston. We'll do something similar in Baltimore, right? But it's about what does the local community need, and for us it's about how do you keep young people safe while you're still trying to get them to work through some kind of process. So.
Great, thank you. Other questions from the audience?
Hi, I'm B.A. Cochran with Redaptive Health. I want to know, what advice do you give to grassroots organizations as they are just trying to build their evidence and use the evidence? Like, where would a grassroots organization start in this entire process? And how do you keep on engaging grassroots organizations at the local level?
So my very first piece of advice for any small organization trying to understand evidence is to get them to go through a theory of change process. So they understand why they are doing what they do and why they are doing it the way they do it. So why do you think your model works this way, and why shouldn't it work some other way? And in very simple terms, right? Like, you do X, Y, Z, why are you doing that? And why, and what do you think the outcome's gonna be? And then literally start to track, one, if you're actually doing it the way you think you're doing it, because we're not always doing stuff, ourselves included, the way we think we're doing it. And are you getting to those outcomes? And so is that thing that you thought was gonna happen actually happening? Roca gets asked a lot to sit down with nonprofits and coach through stuff, and I do some of this stuff outside of Roca, and I would say the same thing to every small agency. Like, for every one of the programs you're running, why are you running it? What do you think you're getting to? What's the goal? Because there are a huge number of agencies out there who can't answer that question. And working through that process and be able to answer that then helps you manage the agency to get you to the goal you want. But if you can't articulate what that is and figure out what that is, and you may need coaching and help to get there, but to get to that spot, you're never going to get to the outcomes you want.
Or know what data you need.
Right.
For me, I think it's your experiences is hugely valuable, and not to forget that. I think from my end, researchers need grassroots experience. They need resident experience. They need that interface. And I think there are times when small agencies feel like they're fighting monoliths, they're trying to get attention from large foundations. It doesn't help folks sleep better at night. But the message is that those experiences of residents and those experiences of community folks are highly prized. And I think it's finding the right partnerships and where those exist and where that exchange exists. Because it might not be the grassroots agency that can amplify their voice the way they need it amplified in certain places, but who's your partner who's gonna do that for you, right? Like, who's that partner who's gonna stand up and amplify that priority that you have, or that work that you're doing, or that outcome that you're delivering, and where does that exist? Because that's what it's about. I mean, I wouldn't ask a grassroots agency to change there necessarily to change how they do business or who they do business for or with, but where's the partnership that's going to help them elevate and create access for them? And as an intermediary, that's one of our top priorities, is how are we thinking about workforce strategies? How are we thinking about amplifying priorities? How are we thinking about sort of amplifying those key issues that are coming up from residents and coming up from community partners, because we feel very responsible for that too. And that's very much our role around what we do. And I ask again, sort of think about, understand the value that you have in those experiences, and that the people who you work with have as well in terms of partnership. But where's that megaphone who's going to take that and say that these are the folks actually doing the work? This is what you should be, in partnership with us. What does that partnership look like? This is what y'all need to be paying attention to.
I think we have time for one more question.
Karen Pittman, the Forum for Youth Investment. I want to build off of both comments, but specifically, Lily, your comment about start with a good theory of change. And often, once you start with a good theory of change, you actually identify what you think are the key components of what you're doing that you think are going to work, whether that's we offer counseling, we create a safe place, whatever those things are. And so I'm wondering, once you get that core thing, in addition to now saying, figure out how to have administrative data so you can know what's working and what's not, wonder if you can comment on the value of what increasingly are becoming sort of models of looking at common components or practice kernels, or ways that we take large amounts of research that have come from, RCT studies and boil it down into, if you're trying to do this, we actually have learned collectively some things that work and don't work better or not so good in that space that you're in. Could you comment on the value of building those kind of clearinghouses or access to that kind of data?
Sure. I think that that is an enormously important aspect of doing systematic reviews of the evidence. There's different ways of doing systematic reviews. One of the ways that the clearinghouse does it is to review particular interventions, and we'll give you information about that particular intervention. But even back in the early days of the clearinghouse, there were debates about how this was going to happen. Was this going to be sort of summarizing interventions, or was this going to be trying to look at sort of key components and what those what the importance, a different kind of meta-analysis essentially about those key components. And I would say that I think that there are some areas of work where that key component analysis is enormously important. I've been doing a systematic review funded by the Wallace Foundation on after-school programs. Many after-school programs are not branded, right? They're kind of homegrown programs. And so especially, this sort of brings it back to, in some ways, when we're talking about sort of homegrown evaluations, I've been struggling, what does that mean that I would be summarizing Cook Middle School's after-school program, right? Is that what we're trying to do, or are we really trying to look at some of these common components? So I think all of these different ways of summarizing evidence are important, maybe more important in some ways in sort of non-branded homegrown areas to do the kind of components analysis that you're talking about. And there's really, sophisticated, rigorous ways to do that.
I do think so we read I spend a lot of time reading research on things that are sometimes relevant to my work and sometimes less relevant to my work, as it turns out after I read it. I think knowing that there's a lot out there and that you don't have to reinvent the wheel, but also knowing that who you're working with and what you're doing. So we look at a lot of pieces of this is a really interesting way to do CBT, and we borrowed, 4 or 5 of them before we actually decided none of them were going to work for our kids. What we know works is CBT. So the thing that we found that was consistently working to help people with emotional regulation and help people with substance abuse issues and help people with their criminal thinking was CBT. What we couldn't find was a CBT curriculum that worked for our kids for a variety of reasons that I don't need to explain here. But so our answer is that we do a lot of that research, and then we figure out how to tweak what we found to make it work for our target population. So CBT works. We tweaked CBT to make it work for our kids, because our kids can't sit through a 25 session in order thing where you do homework, because it's just not going to happen. I'd like it to happen. It's not going to happen. We tried. We told them they couldn't eat dinner until they sat through sessions. It didn't work, by the way. But taking that idea that CBT really works for this thing and then adapting it, or that our whole model is based on a phrase that I can't pronounce correctly, the trans-theoretical stages of change. Blah, that's a horrible word for me. But we tweaked how you use the stages of change that every substance abuse agency and mental health agency in the world knows. We tweaked it around behavior change for young people, right? But it was because we went and talked to the people who developed the stages of change and tried to understand what they were doing and how it worked, because we were just trying to figure out how to move things. So I don't think we invented much of anything. We've borrowed a whole lot of stuff, and we generally say thank you to the people we've borrowed it from, and then we tweak it to make it work for us. But I do think for most nonprofits, reinventing the wheel doesn't make a whole lot of sense. And I say that when we say we're unique all the time, right? But we liberally stole our transitional employment model from CEO in New York. Like, we give them credit for it regularly, but we stole it from them. There's no doubt about it. It looks exactly like their employment model, right? Because it worked, and it worked with the right target population. And so why would we recreate that? We just quite honestly, we don't have that kind of time or energy, and we want to move these kids along. So I don't know if that helps.
Thank you. All right, folks, I think we've come to the end here, and I really want to thank our panelists who joined us today, our panelists from the earlier session, and our co-sponsor, the Forum for Youth Investment. Thank you so much, and thank you all for being here.